In a world where chronic illness and mental health challenges often intersect, finding reliable treatment information can feel like navigating through a maze of conflicting claims. The rise of alternative therapies and wellness trends has created both hope and confusion for millions seeking relief from invisible conditions that traditional medicine sometimes struggles to address. Today, we're cutting through the noise with Jonathan Stea, a clinical psychologist and passionate science communicator who's made it his mission to help people separate fact from fiction in mental health care as we explore the complex landscape where evidence-based medicine meets the multi-trillion-dollar wellness industry. Dr. Stea shares his expert insights on avoiding predatory pseudoscience while finding truly effective approaches to healing. I just finished reading your book in the last week, and so much of the work I do as a physician is with people often have these chronic invisible illnesses overlapping with mental health issues, and often the medical field has not always served them the best for different reasons. Getting into these other options, these alternative treatments, which, as I've been meaning to do a kind of a series talking about this. So I'm really excited to have Jonathan Stea. He's a PhD in psychology. He is involved in both clinical work, taking care of clients and patients, but also has a strong interest in helping people navigate some of the science and pseudoscience when it comes to mental health science. He regularly deals with society's most vulnerable and exposes and debunks the predatory pseudoscience and grift of the multi-trillion-dollar wellness industry and points us towards a better way to take care of our mental health. So, without any further ado, welcome to the podcast.
Thanks so much, Michael. I'm thrilled to be here, and I appreciate your very kind words of invitation.
Yeah, well, can you just tell us a little bit about your background and how you got into the world of psychology, and then the topic we're talking about today to help filter through some of the science and pseudoscience?
Totally. I'm a clinical psychologist, so my day job is helping people in an outpatient specialty clinic in a hospital setting. What our clinic does is see people who experience moderate to severe concurrent addiction and other psychiatric disorders at the same time. I work on a really fantastic interdisciplinary team with other psychologists, social workers, psychiatrists, addiction medicine, physicians, nurses, occupational therapists, etc. I do individual therapy, group therapy, case management, stuff like that over 10 years or so. It's really kind of a passion project I've really taken to science communication. And I think I really got into this probably about 7 years or so ago because psychologists have a code of ethics, and one of the principles in our codes of ethics is a responsibility to society. And in part, what that principle or code means is trying to help the public navigate accurate information, and it really involves debunking misinformation and pseudoscientific practices. I really got into this area probably from my graduate student work. I was working in the area of cannabis addiction and how people recover from cannabis addiction, and there's a whole lot of myths around just the nature of cannabis. Is it a natural plant? Is it helpful? Is it harmful? What does it do? Does it help pain? Does it help anxiety? Do people even get addicted? So that's kind of where I started. And I went on to social media. My mind was kind of blown because I realized that misinformation extends far beyond cannabis and addiction, just to health in general. So I found a really wonderful science communication community where people were fighting the same battle, trying to help people navigate the mess of misinformation and pseudoscience. And then after doing this for about 7 years or so, and myself just learning so much about these topics along the way, I decided to really compile all of that into a book to try to localize it to help people answer questions for themselves, because people would email me or DM me on social media asking me things like, is this article legitimate? Or is this treatment pseudoscience? Is this guy a quack? Is this website a scam? Etc. That's sort of the aim of my book, and the podcast invitations that I'm happy to take is to try to really just help embolden people and empower people to make more informed health decisions, particularly with respect to mental health.
Yeah, well, thanks so much for doing that. When we look at why do people turn to pseudoscience in mental health, many people may turn to alternative treatments because they feel dismissed or rushed by conventional healthcare, sometimes limited to 10 minutes and one topic per visit. Is the problem more about the appeal of pseudoscience or medicine's failure to listen, especially for those with complex conditions?
It's multifactorial. I think all of that kind of contributes to it. To help me understand it, I try to think of there's different levels or layers for why people are susceptible to misinformation and why people even turn to alternative medicine. So, we have the individual level. So there's certain cognitive processes that are happening. So basically the information that we all read is never really objective, because all the information that I read, that you read, is influenced by our perceptions, our belief systems, our prior histories, the people we grew up with. All this stuff kind of impacts how we actually interpret information. And then we have different thinking styles. This work was pioneered by Daniel Kahneman, where we have these intuitive thinking styles, which are effortless, where we just do a gut reaction and make a decision based on information, versus more of an analytical, deliberate, effortful kind of analyzing of information. Research actually shows that when we can activate that other kind of style more deliberately when we're evaluating health information, that is associated with being less likely to fall for misinformation. So there's cognitive stuff just happening. That's one layer. There's personality variables that are also happening. So people have different kinds of personality makeup and personality traits, like openness to experience, or how likely someone is to fall for conspiracies. It's a construct or a trait called conspiracy mentality. People that tend to score higher on these traits, again, are kind of more likely to fall for misinformation or pseudoscience. And again, it's not just any one of these particular variables, it's kind of the interaction of all this stuff. There's also just a lot of mistrust and distrust in our healthcare systems themselves. There's a lot of lack of access and availability of evidence-based treatments on another level. And then, of course, we're also all targeted with misinformation and propaganda, whether it's from your random Instagram influencers or grifters, or even just more well-funded, larger scale organizations. For example, the Children's Health Defense, which is one of Robert F. Kennedy Jr.'s propaganda vehicles for anti-vaccine propaganda. This stuff targets us, and we're bombarded with a lot of fake news and false information. And then there's a psychological phenomenon called the illusory truth effect, which means the more times we see and hear misinformation, the more likely we are to believe it, because our brains aren't very good at differentiating familiarity. So if we're immersed in a community, an online community, a Facebook group, or whatever it is, where people are sharing a lot of misinformation and, maybe alternative medicine treatments that don't have any evidence to support them, but we may likely start to believe it if that's kind of, that's our community, and people are saying that it works, and they're elevating that kind of anecdotal evidence. So long-winded way to answer the question, which is there's lots of moving parts here and lots of kind of layers to account for why people fall for it. And you and I were just briefly chatting earlier, and I do want to really highlight and drill this point home, that it's not about blame and shame, because everyone at some point turns to alternatives, because all of us have health ailments, either ourselves or people that we know and care about. And it's very normal and expected that we want to cure ourselves or help manage our health conditions. And so it's no wonder desperation is very intoxicating. I have a personal history with that, and my patients have that. As a clinical psychologist myself, I'm unable to help all of my patients, even with our best evidence-based treatments. So I get why people turn to it. And at the same time, it doesn't justify the promotion of pseudoscientific treatments, which can often be harmful or untested for safety and effectiveness.
And I guess, how does that wellness alternative pseudoscience industry exploit that emotional and physical needs for that?
It absolutely does. I mean, and that's sort of my biggest beef with it, is that it runs off financial and emotional exploitation for many reasons. It's a lot of what I try to do in the book is try to make the case that, alternative medicine itself is not just a set of unsupported treatments or a set of pseudoscientific treatments. Like, it's not just energy healing or homeopathy, et cetera, but rather it's a broader ideology. So what I mean by that is it has its own tropes, which are repeated themes and ideas. It has its own fallacies to cajole audiences. And it's really a kind of narrative that's predicated on the idea that it sows distrust in mainstream healthcare and medicine. That's what it needs to thrive. So it's not just that they have the answers, it's that mainstream medicine is often wrong. They just mask the symptoms. We treat the root cause. We have the actual solutions. And so it really overpromises, it oversimplifies health conditions and oversimplifies its solutions. And that's my biggest gripe with it, is that it's a lot of false hope, a lot of false promise for treatments that are very potentially unsafe and untested. It runs on that kind of exploitation, and that's a narrative. I'm not necessarily saying that particular people are maliciously out to financially exploit someone or harm someone. I think far from it. The vast majority of people who I think sell or promote alternative medicine are probably caring people who do want to help. But what I believe is going on here, and the argument that I try to make in the book, is that they're being motivated by an ideology that kind of transcends them, and they're parroting that ideology, and that's what they're using to market their pseudoscientific wares, so to speak. And a lot of it is predicated or based on deception, unfortunately.
Yeah, there's so many nuances with this, and often there's partial truth mixed with it. I think if it's just purely pseudoscience without a fair amount of good evidence-based information on just healthy living, like good sleep, etc., probably wouldn't fall through or go through. Can you describe what patients actually experience when they go to more of this integrative functional medicine, alternative medicine type practitioner, and what makes these experiences so persuasive for them?
Yeah. Well, and I'll comment on the first thing that you mentioned too, like sleep, exercise, nutrition. In my view, these things rightly fall under the purview of evidence-based care. As we talked about, this kind of lifestyle medicine or lifestyle treatment. I run a self-care group every week, and I talk about it every day with my patients for over 10 years to address mental health concerns. But again, that ideology in alternative medicine tries to claim itself, or tries to claim lifestyle medicine as its own. And that's a ploy. There was a family physician, Michelle Cohen, and I want to quote her, and I want to get it right because she said it so perfectly. She said, "There's a huge difference between lifestyle counseling and selling a cure-all based on lifestyle medicine. The former makes you a healthcare provider, and the latter makes you a grifter." Because that's often what we see in the wellness world, is that people are selling lifestyle as a cure-all, and again, over-promising and not couching it in the context of a broader treatment approach. It's very foundational, but it's not the be-all, end-all. And what we see in the wellness community is marketing it as a be-all, end-all, and often to the point of overemphasizing personal responsibility at the neglect of things like genetics, luck, social determinants of health, that kind of stuff. But back to your question, which was, sorry, I kind of went.
Yeah, what do patients actually experience when they go to an integrative or functional medicine, alternative medicine type clinic or practitioner, and what makes those experiences for them so persuasive?
Right. Well, it can be quite lovely. And that's why it is kind of persuasive, because they'll go in there and, they may be getting some lifestyle counseling, which is very intuitive, and that's fantastic. It kind of gets a foot in the door. I list this as one of the propaganda tactics that these clinics use, called a bait and switch, where they'll give kind of common sense health advice and then kind of switch to trying to sell you a pseudoscientific treatment, or assessments, like really expensive testing, blood testing, and that's often not scientifically supported. And then it'll give you some results. So then you need to take those results and buy the supplements that they're marketing for themselves that, again, are kind of pseudoscientific or unsupported. That stuff is the dangerous part of it, what I try to call attention to. But again, the other piece that I think is very alluring for people, or persuasive, or just attractive in general, is the fact that often these places are privatized, and then there's just basically a lot of time to spend with patients. So at least where I am in Canada, the mainstream medical healthcare system is not set up to hear patients and to see them, so to speak. So if you go to a family physician, you get maybe 5 to 10 minutes to talk about one health concern. And then maybe you're referred to a dangerously long wait time, even in my area of mental health, 9 months to 12 months to a community mental health clinic to address your post-traumatic stress disorder or your depression, which is hugely long. But if you go to a private alternative medicine or functional medicine or integrative medicine clinic, you'll get a clinician in there that will see you and hear you and validate you and empathize and listen to you. And that stuff is what we call in the psychotherapy world the non-specific factors of change. So basically meaning, a lot of what we do in psychotherapy is forming a therapeutic alliance and cultivating a therapeutic relationship with people. That's an important component besides the specific factors of a particular treatment, like cognitive behavioral therapy. Just the fact of forming a therapeutic alliance, hearing people, validating them, expressing empathy, engendering hope, encouraging new ways of thinking and behaving. All of those are kind of evidence-based principles, which I believe in the alternative medicine world, those practitioners kind of clumsily stumble upon them. Some are better than others. It just so happens that mental health professionals are actually trained to do this. It's kind of our forte. I think that's also what allures people or lures people into their snares.
Yeah. One, you mentioned earlier, what are some of the traits in intuitive thinking, openness to experience, and being more susceptible to these sort of pseudoscientific claims and conspiracy theory? And one of the things that I've seen overlaps with a lot of people living with chronic pain syndromes are many high rates of autism or autistic style neurotypes, neurotypes, and some of that has a little more black and white thinking, all good, all bad, and sometimes hard to see that nuance. You didn't mention it specifically in your book, and it's just as a clinician understanding, I hate the word higher functioning, but maybe less with that. Is that part of what you're seeing in some of the more susceptibility traits? I don't know if you've noticed some of that or in some of that overlapping with what you mentioned earlier.
I think it's really about what we do in healthcare and as scientists is we use a lot of tentative language. The topics that we talk about are super complex. Mental health conditions are super complex. The chronic pain conditions are super complex. And what you see in the wellness world is that kind of black and white advertising. It appeals to emotion. It appeals to, again, oversimplified ideas of what works. And all of us, I think, are just susceptible to that style of thinking. And it does take a lot of effort to override that intuitive thinking style. And if we're disadvantaged in that way, then I think it leaves people more vulnerable.
Yeah, and part of what motivated me to write a book on this topic was there may be a book on this and it has good information, and then 20% is, oh, by the way, I'm selling a supplement that's just not so good. And I'm like, can we just have a book that gives good, comprehensive, evidence-based medicine? And doing a podcast, like, oh, I could make a bunch of money promoting a special supplement and mixture of things, but that's unethical when we know that those are. And part of where a tagline I've used with this podcast is that office visits are short. These chronic pain syndromes are complex. And hopefully, as part of this conversation and a broader conversation, as people start taking in these in, they can start to see this nuanced understanding. Like, it's called conquering your fibromyalgia, meaning it's an ongoing battle. Like, there are life stresses and complexities of, like you say, the psychosocial, spiritual, environmental aspect that are out of your control or limited control. Caring for an elderly parent who lives with you, who gets up 2 times a night, will limit the amount of improvement you can get until the environment changes, so to speak. Somebody could say and argue that how much harm can it be? You know, is this really any harm? What if it's just a benign supplement that is inert, like it's neutral? What can you speak about that? These maybe not having scientific support, but maybe aren't directly, no, it's not direct poison. You're not giving somebody mercury or actual lead or something like that.
Yeah. What helps me understand this topic is to really think of pseudoscience as harmful in at least 3 ways. The first is that it can produce direct harm as a result of the treatments used. So even particular dietary supplements could result in liver problems, especially if it's unregulated and you don't even know what's actually in that supplement. There's a whole psychological literature on actual psychotherapies that can be harmful. There's a whole host of harmful psychotherapies, pseudoscientific treatments that can actually harm people directly. In severe cases, cause death. Even if it's not death, it can just worsen someone's health symptoms or mental health symptoms. But it goes more than that, because pseudoscience is also just indirectly harmful, meaning it can take a lot of time and money and resources in general away from people when they could have been expending those resources on evidence-based care. Now they're watching their wallets dwindle and their mental health symptoms could be getting worse, or their health symptoms could be getting worse. That's a huge harm in and of itself. And then I'd say the third is a bit more abstract, but it's sort of pseudoscience can, in my view, be really harmful at the level of society, at a social level, because when pseudoscience becomes tolerated and baked into our culture and our institutions and our healthcare systems, then that it can really undermine public health and patient care more generally. And so that's sort of what I mean by the social level.
What are some of the most common pseudoscientific practices infiltrating mental health care?
One of the things when I was writing my book that I don't know that it surprised me, but maybe it did, was, I went into this writing a book, more of a niche book, like pseudoscience and misinformation in the realm of mental health, because there weren't a lot of people doing it. But as I started to write the book, I realized that it's not very particular to mental health. And, that shouldn't be surprising, because a hallmark of pseudoscience is promoting a treatment or approach as a panacea like treatment or approach. So it can not only cure your depression, but also your chronic pain and COVID-19 and your glaucoma and your dog's anxiety and whatever it is. And so there are several pseudoscientific approaches that are just everywhere in the wellness industry that I don't think are particularly specific to mental health. But for example, energy healing or naturopathy, all of those things are very much marketed towards depression, anxiety, PTSD, but also literally every other health condition. I would say, though, that within the world of mental health, alarmingly, scientists have estimated that there are at least 600 brands of psychotherapy out there, which is an increasingly growing number. As a trained clinical psychologist, that number to me is just completely absurd. I probably can't name more than 10 psychotherapies that are evidence-based. A lot of them end up recycling evidence-based principles and repackaging them in different ways. We have some good solid ones that work for a variety of conditions. When you get 600 out there, it's sort of a huge pseudoscientific red flag that should get our spidey senses up.
Yeah. You write about these conditions or diagnoses that are within the alternative medicine world. A couple are like leaky brain syndrome and leaky gut, that these often might even be in the mainstream, that people may talk about it. And this is maybe people who might otherwise trust science. Why do you think these pseudo diagnoses have gained such traction?
I think they're marketed well. We've all heard of a leaky gut syndrome, maybe not leaky brain syndrome, but adrenal fatigue, leaky gut, etc. And these are, like you mentioned, they're not recognized by medical consensus or broader medical societies. That can be quite dangerous. The wellness industry kind of exploits those fake diagnoses. I want to make clear that the diagnoses themselves are fake. The symptoms are very, very real. People are experiencing fatigue or depression or pain or whatever it might be. The explanations used to account for those symptoms are fake or not scientifically supported. And that's quite dangerous, because if you're given a fake diagnosis like leaky brain syndrome or leaky gut syndrome, the harm is that it's now a misdiagnosis. And so you might not be getting a helpful treatment for that. And it could actually be a dangerous treatment. So, for example, a supplement or a medication or even just any other kind of pseudoscientific approach. So it's I think also very appealing for people, because often these fake or these invented wellness diagnoses are often very complex. They're sort of a catch-all category of medically unexplained symptoms. So there are things like fatigue and depression, which are symptoms of a whole host of health conditions that we can't even enumerate right now because there's so many. And that's why it's often very appealing for people, because if they don't have a good explanation medically from the mainstream healthcare system, then it's very compelling to cling on to the label that might help someone make sense of what's going on for them.
And it's using that pseudoscience is mixed with science, like they may use the word bacteria, use the word adrenal gland, and there are conditions, Addison's disease, where you have adrenal shutdown and they can have these. So there's that name mixed in. The rest of it often doesn't fit. Most of these syndromes really fall into the purview of these invisible chronic pain illnesses, the chronic fatigue, fibromyalgia, overlapping pain syndromes, IBS, disorders of the gut-brain interaction. All of these have so many of these. Now we call the broader term nociplastic pain conditions, where it's the chronic fatigue, brain fog, cognitive struggles, insomnia, poor sleep. All of those are part of these conditions, and hopefully with more information, doing my best to help share the evidence-based understanding of these complexities and different names to that. And unfortunately, a lot of medical doctors don't have a lot of training on that in 10-minute visits. How do you explain the nuances of all these complex issues? And you mentioned something earlier, and I had a patient of mine who said, who has fibromyalgia, it's co-occurring ADHD with this, and unfortunately, like many places, maybe in Canada and here, there's been some shortages and supply issues with it. So it's been frustrating trying to get it. And it's helped her. It's made a big difference. But then trying to wait and hassle that we kind of call it in every month and it's pharmacies out. And she's like, you know what? I don't know. Maybe I think I want to find the root of the problem. And it's like reading your book, that root of the problem is really likely in that alternative medicine world, who's going to say, yes, we validate. Yes. And we have a name. You can go online and say, if your doctor tells you have fibromyalgia or chronic fatigue, don't believe them. That's that's a made up diagnosis. And you have mold toxicity, or you have some lead or whatever these, and you need chelation therapy, kind of echoing what you were saying, often what they're seeking, because these are conditions that we're talking about that don't fit well into the biomedical only model. They're the whole comprehensive biopsychosocial, spiritual, environmental aspect that are quickly fixed in the world of medicine once we got x-rays and antibiotics and things that are very targeted that can help, and they don't fall out of the purview. A lot of doctors don't want to spend time. Surveys of doctors in Norway have shown that fibromyalgia is the least prestigious illness by surveys of medical illnesses. At least we know if somebody's got leukemia, we know what that is, and we can target the chemo for that. If somebody has that, it's much more defined.
Absolutely. That's probably the alternative medicine trope that drives me the most bonkers, is that they only address the root cause and mainstream medicine doesn't. And the reason for that, like you said, there's kernels of truth here. In mainstream medicine, we're always trying to look for a root cause and trying to address it. We do that in psychotherapy, try to do it in chronic pain, but you're right. Sometimes we don't have good explanations about what those roots are from a scientific perspective. But in the alternative medicine, the wellness world, you're getting that trope abused. It's on clinic websites, if you Google it, that they know the root cause. And it's often a pseudoscientific or false root cause, because when you dig deeper, the root cause is they need to unblock your energy blockages or treat a diet deficiency that you didn't know you had that is unrelated to your actual symptoms. That's the one that really gets me. I urge anyone to Google an alternative medicine clinic website and you'll find that trope. I'll put an arbitrary number to it, but 9 out of 10 times.
Yeah. Another interesting one, and this kind of gets into the borderline area of things. And I was actually just talking with a patient of mine, and I've had this, and I think I'm ahead of the curve of understanding health because it overlaps. I've had a passion of this throughout my medical school and career as a pediatrician and internist, but no, that's so important, recognizing that's just important. So humbly speaking, but one world that I haven't learned as much about, you mentioned in your book, and a lot of my patients subscribe to this, is EMDR. And it was interesting because in my mind, and you have a bandwidth, so I haven't done a deep evidence-based dive into that therapy, but it kind of made me go, what does eye movement have to do with that? I just had a patient I did a visit this morning who said, Doctor, does have a history of fibro, substance use, fibromyalgia, autism, all of this, and says, no, I think it's really helping. You brought up a point, and it wasn't a big part of it, but it caught my attention in your book about, well, we don't know if it's the eye movement, but probably the other parts of it are actually helping. Can you comment on some of the science that we know about EMD, what we do know and what are the known knowns and what are the unknown knowns?
Totally. I love talking about that topic, and I discuss it in the book using a metaphor called a purple hat therapy, which is not my metaphor. It was initially written in 2003 by psychologists Gerald Rosen and Gerald Davison, where they were basically critiquing evidence-based treatments, or the way we evaluate evidence-based treatments. And specifically, they were targeting the new revolutionary therapy at the time, which was EMDR, as a treatment for post-traumatic stress disorder. Basically, in a nutshell, what EMDR does is it has these kind of eye movements where you have a patient go through a sequence of eye movements while they're speaking about particular traumas that they've gone through. And that's supposed to be helpful. And there's a whole theory behind it about how the eye movements might make sense. One of the things that they're doing is when they're imagining the trauma and processing that trauma, that happens to be a core component of another evidence-based treatment that we have called cognitive behavioral therapy. That's an advanced branch of cognitive behavioral therapy, or CBT, called exposure therapy. And that's how I tend to treat people who experience PTSD. We do exposure therapy. We talk about the traumas in a very safe, voluntary way once people have the coping skills in order to feel comfortable that they can do that, because that's what our research shows to work. But in EMDR, the critique was, well, like you mentioned, is it really the eye movements that are accounting for the change for what actually helps people with PTSD? Or is it the act of processing the trauma and talking about it and imagining it? And that's a debate that's still ongoing in the psychological literature. The metaphor of purple hat therapy was basically, you can imagine if I'm doing therapy and I'm wearing a purple hat, is it the purple hat the thing that helps you, or is it the actual processing of the trauma? And of course, it's the processing of the trauma. The purple hat is just the bells and the whistles. And so it's a critique of EMDR because it's asking, are the eye movements an actual purple hat? So is it just bells and whistles? And is the mechanism of change actually the exposure? There's ongoing debate in the research literature right now. My reading of it, again, it's still controversial, is that it is more of the exposure is the actual mechanism of change, and there's very little to do with, if at all, with the eye movements. That said, I would say that for my patients, I don't do it EMDR, but I'm happy if my patients would receive EMDR from a different practitioner, because I'm confident they're at least processing the trauma, and the research does show that it's now classified as an evidence-based treatment. We just don't know. Gerald and Rosen critiqued using purple hat therapy evidence-based treatments because the idea is that we can do a randomized controlled trial for a treatment and find that it's useful, but it doesn't really address the idea of scientific plausibility or the mechanisms of change or why that treatment's helpful. We just get the outcome. And so we need further research called dismantling studies that try to dismantle the treatment to figure out what is the actual mechanism of change.
And one thought I had, and I don't know if they've thought about this in this particular patient, is autistic as well. And I thought, well, sometimes eye contact's uncomfortable, and maybe in a therapy session, having the freedom to not directly look at your therapist and have eye movement around might be more calming than the masking of having to feel like you have to look at your therapist. I don't know. That's one thought. If there was potentially, and maybe in a subgroup of patients who may have that maybe that's allowing them to not have to look. I don't know.
There's fascinating hypotheses. And to be frank, like what kind of makes and they don't really tie it to the theory, but when you think of someone sleep and they're in REM sleep, rapid eye movement, that's, rapid eye movement is involved in consolidation of memories.
Yeah. And that's actually what my patient, I said, I'm going to be talking to you today about this. I've known her for a long time. And she mentioned that. I think my kind of quick analysis is the eye movement while sleeping is kind of a reflex response, not the end result. You can't reverse engineer that. It's more downstream. But so you also brought up and talked about the Amen clinics and use of neuroimaging as a diagnostic tool. And can you talk about them? There's also what's Kelly Brogan you brought up, and are they grifters? What do we know about this, and what can you share about that?
The Daniel Amen, really popular, $1 million, I've forgotten the figure now, but hugely successful person. I saw them on the Kardashians when I was watching it with my wife, which is a guilty pleasure of ours, because, it was, I forgot which one, but one of the Kardashians was at the clinic, and he has this machine called a SPECT machine, which is basically neuroimaging, and it images the blood flow in the brain. And so he's showing her a beautiful picture of her brain, and he's pointing to it and saying, that's where your emotional trauma is. This is where ADHD could be, or trauma could be, etc. And it just really annoyed me because in the clinical world, that's just not how we diagnose in psychiatry and in clinical psychology. That's not how we diagnose mental disorders. I mean, SPECT itself, the kind of imaging technique he was using, is not pseudoscientific. It's really great. It's a helpful tool to even help diagnose structural abnormalities and things in the brain. But when it comes to diagnosing mental disorders, we don't have lab tests or brain imaging techniques to say you have ADHD, PTSD, or you have depression, or whatever it might be. So that, in my view, is quite the grift, because when people go into those clinics, they're paying thousands and thousands of dollars to have their brains imaged, to get a diagnosis, to then be sold really expensive supplements that are somehow going to, I don't know, help improve the flow of blood to their brain, or however these grifters pitch their pseudoscientific approach. Because the reality is, the psychiatrists that I've been working with, myself as a clinical psychologist, we've been diagnosing mental disorders for very long time. And you just don't use neuroimaging, and that's what you'll find in clinical practice guidelines in the scientific literature. I find that terribly exploitive because, again, people are going to these clinics at moments of vulnerability. They're experiencing depression, they're experiencing PTSD, et cetera. And that's very dangerous. And, you mentioned Kelly Brogan, and that's another one. She wrote a book about depression. And if you read some of that book, like it's promoting a laundry list of supplements that are critical to your health. And it's instilling doubt whether the scientific construct of depression is even real. And it's fear mongering about other really important evidence-based treatments like Advil and antibiotics and vaccines. And it's basically selling a cornucopia of misinformation. And that's, again, why in part I wanted to write the book, because there's a lot of people out there, even with respectable credentials, MDs. Kelly Brogan's a quote unquote holistic psychiatrist. Daniel Amen has an MD. There's lots of MDs out there. And there's a phenomenon called the Einstein effect, which is the idea that when we hear scientific claims or health information from someone with good credentials, like a physician or a mental health professional, we're more likely to believe them than, say, a wellness guru without those credentials, because who wouldn't? We're supposed to believe our experts, so to speak. But, I caution viewers or listeners and readers, it's not really about any one particular expert that's trying to tell you something. I would kind of look to things like scientific consensus. So where you can get an idea of scientific consensus is by looking at large bodies of experts like the American Psychiatric Association or the American Psychological Association or the American Medical Association or whatever it might be, and their particular kind of niches.
Yeah. And going along with this, and I sent some information to you in the questions and didn't bring it up in the book, but it overlaps into the world of fibromyalgia, chronic pain, is Dr. Sarno's symptoms. And it's gotten a lot of popular press with looking at the impact of pain and the whole model of understanding that, with popular podcasts continuing to talk about this. And I don't know if you got a chance to look at that, but did you get a chance to look at some of that?
I did get a chance. Yeah. Again, chronic pain is not my area of expertise, but I did look at the information you sent. And what struck me about it was that I kind of drew a parallel to almost the anti-psychiatry movement and their kind of work that I do write about in the book, because essentially what these kind of models end up doing is a very cheapened view of complex health conditions. And so in the anti-psychiatry movement, for example, what they'll do is what I call kind of psychosocial reductionism, which is a fancy word for saying, we have a biopsychosocial model, say, meaning there's biological contributions, psychological contributions, and social contributions to how we understand mental disorders and mental health. And what anti-psychiatry does is it likes to cut off the bio part of the biopsychosocial model. It just reduces it to the psychological stuff and the social stuff, which has kernels of truth, but it's an oversimplification. And then you don't do our health conditions and their treatments justice. So in a parallel way, when you set that chronic pain model, I saw the same thing. It looked to me like a almost psychological reductionism, where it's removing the biological contributions to chronic pain disorders, say. And I think ultimately that stuff's quite dangerous, because when you don't take a full nuanced view of chronic pain conditions or mental health conditions, then you're left with a non-evidence-based treatment approach, because you're cutting off a whole repertoire of evidence-based interventions. And kind of worse than that, because again, you're sowing distrust in those other helpful components, particularly the biological components.
Yeah. And for those who aren't familiar, and Nicole Sack is a very popular podcast, and also has written books on this, and kind of the difference between what we call the modern nociplastic pain model, that biological understanding combined with the psychosocial, spiritual, environmental aspect of this. But etiology for that model is that repressed emotions lead to circulation problems, versus central sensitization, neuroplasticity, pain mechanism, the psychosomatic distraction signals, versus cerebral amplification and nociceptive differences, treatment focus, emotional journaling and insight, versus education, gradual movement, stress, treating coexisting medical conditions if they're there, like restless leg, ADHD, sleep apnea, etc.
kind of goes to Freudian ideas, which are pretty much, I don't know if there's much of use in Freudian, but that repressed emotion kind of theory and its rage, and that the core is, imagine, overlaps so much with what you've talked about in the book, that there are these repressed things that you have to get, and you have to scream out things. And you may go, I don't even know if I have any repressed emotions. I don't remember any trauma, but you must have, because that's why your pain. And granted, a lot of people who have chronic pain syndromes and neurodivergent people have higher rates of having gone through trauma. And then their role, the element that what is the role of emotions, and that's the primary cause, that's like the psychological basis, versus nociplastic is, well, it's one component of these many multifaceted approach. That's kind of the framework. And yet when I've had patients, and I was early and ready before I wrote my book, I was reading about this. I'm like, oh, there's some good things. And then I'm like, what? Wait, you know, oh, shoot. Again, there's some aspects, like it's not all in your head yet. It is how your brain works, but the focus, they take the bio part. And now we're learning, as I did an episode with, that's what we know, there are differences in how the brain functions and different parts of the brain that have implications. It may dismiss the role of these other factors, like you said.
Yeah. And often it's an exploitative kind of way of doing it, because they're often selling their own kind of treatment or approach, which is very disingenuous and unfair to patients.
And then, there may be selling, here's my retreats, and here are these things and outcomes and books and all of that. There may be some good things. Maybe people are getting some improvement, but is it also not fully up to date? Hopefully people can see that more complexity than this. So a couple more sections here. Helping people think critically and stay safe. What red flags should people watch for when evaluating a new therapy, clinic, or practitioner?
Yeah, that's a great question. I kind of wrote the book to address all of it because it's so loaded. So it's hard to do in a sentence or so. But, essentially, I really wanted to teach the language of pseudoscientific grift and kind of alternative medicine advertising, because I think, like those tropes that we mentioned, because I think once people learn these warning signs and these tropes, it's very hard to unsee. And that's what we need to strengthen our grift detectors, so to speak. So, for example, in the book, I list 9 pseudoscientific warning signs, things like testimonials on websites rather than literature, claims that are divorced from the broader scientific literature. So, for example, homeopathy treatments can't work and energy healing treatments can't work, because the claims that they're using would essentially undermine our understanding of how pharmacology works and how physics works, because they're very just kind of really out there. So trying to learn about that kind of stuff, just sciencey sounding jargon and language that doesn't quite make sense. As I'm saying this, it also calls for a review to trying to increase our science literacy skills and our mental health literacy skills, which I recognize can be a very hard thing and sometimes a daunting thing as well. But I also think it's a necessary component to defending ourselves from these kinds of scientific wellness pieces of information that are out there that are duping us. So there's lots of different ways. I wish I could kind of do it justice.
Yeah, I think definitely for those interested to check out your book and go through. At the end of the book, you have listed, I feel like I was in a philosophy class trying to understand different arguments and logical fallacies and all of these things that help, which is often there's an emotional basis to things. And like we say, if you're already bought in, it's hard. One of the things that you shared in the book, and whether you feel comfortable sharing it here, is you talked about seeing firsthand the struggles with your own mom who went down these paths.
Yeah, I'm happy to share a bit about that. When I was growing up as a kid, my mom has always had kind of health concerns. At one point, she had a botched spinal surgery, and that left her with really debilitating chronic pain. And we didn't know what the heck was going on. I was an only child living with my mom. She had excruciating pain. At that time, it was diagnosed as reflex sympathetic dystrophy, or RSD. And nowadays, my understanding is now a complex regional pain syndrome, which in and of itself has it's a big umbrella term for a bunch of chronic pain symptoms. But as a kid growing up, when I was about 11 years old or so, I saw those symptoms with my own eyes. Like her legs would swell up, like double in size, and they would leak fluid, and she would scream if wind even touched her, and water. And it was a lot of problems. And so we ended up trying everything. It felt discouraging because mainstream healthcare wasn't helping us. So we turned to alternative medicine. We tried literally everything you can imagine, all of the alternative medicine treatments that are out there, from chiropractic to acupuncture to incense to psychics, even like literally anything that we could try. And it was hard. And of course, complex regional pain syndrome, like you mentioned, is a thing to be managed. There's no cure. It takes a biopsychosocial approach to get this stuff under control. And, she even developed mental health symptoms at the time due to that. People get depressed, people get anxious, people get stressed. Fast forward to today, I can talk about this story happily because my mom is living a fantastic quality of life. Her chronic pain condition is under control. She still gets flare-ups, etc., but she's learned to manage it with activity pacing and relaxation techniques and exercise and mental health coping skills and things like that. And when I was a kid, I was actually injecting her with horrible opioids and benzodiazepines, things that actually didn't help her. So she doesn't use any of those anymore. I'm quite happy about that, but it really motivated me in my career as I kind of grew up, because as a kid, I got to see with my own eyes that mainstream medicine, you think we know what we're doing, and we do to an extent, but there's also huge gaps in our knowledge and huge gaps in our healthcare systems. And I saw that, and it kind of motivated me because that's in the chronic pain area, which is your area. My area is the area of mental health and mental illness, and it's very similar. We don't know a lot about the science of psychopathology. We don't know how to help everyone who has PTSD and depression. But what drives me bonkers is that just because we have gaps in our knowledge in healthcare systems doesn't mean it signals a call to fill those gaps with better science, better access to care, ethical, competent care. It doesn't justify filling those gaps with exploitation and pseudoscience and masquerading under the banner of wellness and integrative medicine or functional medicine or whatever it might be. And so I don't like how there's an entire industry set up to exploit people's mental health and people's complex health conditions. I think I was probably shaped by that growing up.
Before we wrap up, any other thoughts that you'd like to share that wasn't covered yet?
I think we covered a lot of it. I would just say that, the attitude or the spirit of our chat today and kind of the book that I was trying to go for is really about skepticism, not cynicism. We don't need to be cynical and poo-poo all of these treatments. Our goal is to really just have people take more of a skeptical lens to all of the approaches out there, particularly the ones that overpromise and don't have a lot of scientific backing to them or are essentially pseudoscientific, because patients deserve the best care based on the best evidence. And in my view, that's not what the wellness industry offers at all.
Tagging along with that, how can clinicians, educators, science communicators do a better job of making evidence-based science resonate with those who might be vulnerable to beliefs?
I think it's just, again, our ethical duty to do our due diligence with respect to being very transparent, being very open and honest with respect to what we know, what we don't know, the limitations of our treatments, the effectiveness of our treatments, and trying to empower patients through accurate information. Because in the wellness industry, you can't be an empowered patient if you don't have accurate information. And I think that's what us as clinicians can do, is try to empower people with accuracy.
Well, thanks so much for taking your time. For those who want to connect with what you're doing more, how can they connect with what you're doing either online and with your book?
Thank you for that. Thanks for your advocacy and your work as well, Michael. I really appreciate that. If people want to connect with me, I spend way too much time on social media. So X, Facebook, Instagram, Blue Sky, Threads. But probably the easiest way is to just go to my website, which is my first and last name.com. So JONATHANSTEA.com.
And we'll have a link for that in the show notes.
My pleasure.